We now begin Part D, our wrap-up. Having knowledge of breastfeeding best practices is a first step for caregivers. Creating a supportive breastfeeding environment is the next step. Program policies help early care and education programs maintain consistency in their program practices. In this section of the module, we will examine breastfeeding policies in early care and education. Quality child care programs have written policies and procedures available. Some child care providers may put this information together in parent handbooks. Having policies in writing is a sign that your program has put time and effort into deciding how they will care for children and operate their business. Additionally, written policies and procedures help make sure that all staff, volunteers, and parents understand and follow the policies and procedures. Parent handbooks may also outline your program's policies and procedures. They may include just the information that is important for parents to know. Breastfeeding is a topic that needs a policy to ensure families and staff are communicating and supporting each other in getting the best care for infants and toddlers. The Kentucky Child Care Health Consultation Program has developed a sample breastfeeding policy template that programs can use as a starting point in creating their own policy. The template aligns with current state and federal regulations on child care and breastfeeding. This template is found on pages 10 through 14 in your handout. The Kentucky Child Care Health Consultation website is listed on your screen as well as on the front cover of your handout. On the Resources tab, you will find this policy as well as other posters, handouts, and other information on breastfeeding. Find the final reflective activity on page 9 in your handout around policy. You may or may not be in a position to develop policy for your program. Take a few moments to review the Child Care Health Consultation Policy template on pages 10 to 14. As you read, consider what you know about your program's current practices on breastfeeding. List out 2 things you feel are most important to include in your program's policy, and consider how this might impact the breastfeeding environment at your worksite. As a child care professional, you can create an environment that supports breastfeeding mothers and families. Your role can have a powerful impact. Not all programs have space or resources to invest in creating ideal spaces, but your knowledge, attitude, and encouragement of breastfeeding mothers can make all the difference. Thank you for your work to support breastfeeding in your program and your community.